Dr. Sanjit, welcome. I'm delighted to have you here with us today for an interaction about surgical imaging technologies and breast surgery. Uh, to give a brief introduction, Dr. Sanjit Kumar Agarwal works as a senior consultant in the Department of Breast Oncosurgery at Tata Medical Centre, Kolkata. His main interests include oncoplastic breast surgeries, sentinel lymph node biopsies, post-mastectomy reconstructions, breast cancer research, and health economics. He has an impressive track record of having performed over 3,000 breast cancer surgeries in the last 10 years. Welcome, sir. It is my privilege and pleasure to be a part of this interaction. On behalf of my team, I would like to thank you for sparing time and being with us here this evening. Let's understand from Dr. Sanjit's perspective as to how these new technologies are shaping the surgical landscape. Uh, Coming to the first question, sir, how has fluorescence guided surgery benefited in improving surgical and patient outcomes? Can you please share your experience of using ICG-based fluorescence imaging systems for the benefit of our audience?
Thank you very much, Mr. Ashwin and the Irillic team for giving me the opportunity to do this podcast video. So the surgical outcome overall, both the surgeon experience and the patient outcome has been improved tremendously by the use of the fluorescence guided systems. So it's easy to use because it's surgeon dependent. So what we are doing with the ICG, we are using it intraoperatively. So we don't need to send patient to the radioactive suit for the radioactive dye injection, or we don't need to shift patient. Second thing is it's, as I said, it's operator dependent. So I can start the case as per our list. So if you are dependent on some another department, you need to send the patient and it's a working in the two department. So we have used effectively in the breast cancer surgeries, mainly for the sentinel lymph node biopsy, for flap perfusion, for nipple sparing mastectomy to see the nipple vascularity. It was used, it means it has been used extensively by the head and neck surgeon for the parathyroid surgery, GI surgeon for seeing the anastomosis, and the lymphoedema management. So it has been used in the past also, and we are devising future use also by doing some randomized control trial or some prospective trial to increase the use. And the advantage is win-win type of situation. So surgeon dependent, surgeon friendly, and the patients are getting also benefited by not using radioactivity for the same indication what we were using before. We were using radioactive dye. So radioactive dye, you need to set up the nuclear medicine department, and for the fluorescent dye, it's generally done with a system which is used intraoperatively. So it has many advantage over the traditional use of the radioisotope dye for this use.
Okay, sir. Thank you. Coming to the next question, how is your experience with Irillic, being a Make in India company developing cutting-edge surgical imaging technologies? Would you like to share your experience of having worked with the product and the team?
Yeah, we started in 2017 itself. So at that time, I was struggling to get an fluorescence system. So I went for a conference in the Europe, and I have seen the system used by the European people were mainly from the Japan and the USA. Honestly speaking, I tried at that time in 2017, and no one was willing to come to the India. And I'm very thankful to the Irillic that who has started this pioneer work of developing fluorescence technology in the India. I started in 2017. As you said, it's cutting edge technology. So if you see the equipment carefully, it gives a lot of thing to the surgeon, additional thing apart from the fluorescence. So it gives you the sensitivity. So the in the Irillic system, you can increase or decrease the sensitivity of the fluorescence from 1 to 5. So what we are doing, we are using the different method of the mapping of the dye or the lymphatics or the lymph node or the flap perfusion in different sensitivity. So what we have developed what exact sensitivity you need to use for the particular use, and it's very helpful. Second important thing, what I want to mention, that you really can maintain the whole data set. So you can enter the patient data set in the Irillic system. So if I have done some surgery in 2017 and I have captured some the images of that particular patient, And if I want to go back and retrieve these images in the Irillic system, it's possible with the Irillic system, which is not possible in the many available system around the world with the fluorescence technology. Third thing is that it's easy to move from one OT to next OT, because it's a very comprehensive system. So at present we are working in two stations. We have OT on the first floor and we have OT on the second floor. So it's easy to move. It's not like that you can't move the system once it's installed. So I know many people are working who are taking the whole system in a briefcase and going and doing the work. Fourth thing what I want to mention is the cost. Cost is the very important factor. So the cost wise, it's far less than the available system in the market, and we have reduced the cost effectively for the Sentinel use by using the Irillic system. Because what you can do, if you have one orogreen, that's 10 ml. So we prepare it with the 10 ml of the dye, with the 10 ml of normal saline. And if you have two or three patients in a go to do the surgery, you can use the 1 ml 1 ml 1 ml in many patients, and the same system can be used with the Irillic pore probe cover. So one is the cost, second thing is the easy to use, third is easy to move, and fourth is the multiple option available to adapt you on the sensitivity or the focus you want to work with the Irillic system.